Good morning, Dr. Ida Bagus Putu Alit, Specialist of Forensic Medicine Consultant, Diploma of Forensic Medicine as our facilitator. And good morning, Professor Dr. Imadi Agus Gegel Wirasuta, Pharmacist, Master of Science as our evaluator. Today, we from SGD B10 would like to present our presentation with the title of Forensic Pathology Evidence related to rape drug uses. This is SGD B10 group members. And my name is Mahesa Ajisaka Aryasa with last 3 digits of my student number is 230. And today we will start from the introduction section. First, from the background section. Rape drug is a common term used to define drugs used for sexual assault that can be easily administered directly to the victim's mouth or indirectly by mixing it with beverages. Rape drugs have several properties such as sedation, odorless, tasteless, causes amnesia, and easily diffuse in alcoholic and other beverages. Such drug properties will help the perpetrator to launch a sexual assault easier. There are many rape drugs used commonly, such as ethanol, ketamine, benzodiazepines, and gamma hydroxybutyrate. It is also quite common that combination more than one drug could be detected in rape victims. This drug combination can affect the CNS function so that the victims will be more vulnerable by exacerbating the loss of perceptions and reaction, which also intensify the intoxication risk. Reports and data regarding the incidence of sexual assault itself are likely to be understate the actual number. Factors such as psychological barrier, cultural belief, stigmatization, and lack of trust in the criminal justice system could contribute to the low number of reports and data regarding the incidents. Rape drugs also easily available in the market, on the internet, dance club, illegal readers, and even medical store under the name of sleep or anesthetic drugs, making it much more sensitive cases that needed to handle with care and caution. Therefore, healthcare providers need to understand the correlation between rape drug and the role of forensic pathology evidence in rape drug cases. Understanding the global impact of this condition holds important significance, as it can serve as a guide to clinical decision. The purpose of this paper is to provide a more detailed explanation of forensic pathology evidence in rape drug cases. Next, the problem formulation. Based on the background information explained earlier, the problem formulation are as follows. First, what is the definition of rape drug? Second, what are the types of rape drug? Third, what is the mechanism of action of rape drug? Fourth, what are the effects of rape drug? Fifth, what is the definition of forensic pathology evidence? Sixth, what is the importance of forensic pathology evidence in rape drug cases? 7. What are the types of forensic evidence relevant to rape drug cases? And last one, what are the limitations of forensic pathology evidence in rape drug cases? Next, the objective of this paper. General purpose, to gain an understanding about forensic pathology evidence in rape drug uses. Specific purpose, to understand the definition of rape drug, to understand about the types of rape drug, to understand about the mechanism of action of rape drug, to understand about the effect of rape drug, to understand the definition of forensic pathology evidence, to understand about the importance of forensic pathology evidence in rape drug cases, to understand about the types of forensic evidence relevant to rape drug cases, and the last one, to understand about the limitation of forensic pathology evidence in rape drug cases. And last one, benefits. First, for the institution. Expand available educational research concerning the definition, types, mechanism of action, and effects of rape drug. Expand available educational research concerning the definition, importance, types, and limitation related to forensic pathology evidence related to rape drug cases. Establish a foundation for future research endeavor on forensic pathology evidence related to rape drug uses. Second, for the academician. First, use as an educational tool to introduce students to forensic pathology evidence related to rape drug uses, thus enhancing their understanding of this medical subject. Second, increasing literacy habits, particularly in the field of forensic pathology evidence related to rape drug uses. That's all from me. Thank you.
Thank you for the opportunity. My name is Zefanya Rindy Nathalie with the last digits of student number 166, and I will explain about the definition of rape drugs. So, rape drugs is a drug that can cause biological effects that facilitate sexual violence. The consumption of rape drugs could occur voluntarily or unintentionally by the victim, resulting in acts of sexual activity without consent. Offenders may secretly adulterate the victim's drink with sedatives and sexually assault the victim, who is under the influence of the substances. Therefore, in recent years, drug-facilitated sexual violence has become a growing concern in the health community.
Om Swastiastu, my name is Immanuel Krisliandi and the last three digits of my student number is 132. Okay, so now I'm going to explain about the types of rape drugs. The main drugs that are used in drug-assisted sexual assault are painkillers, antidepressant, antihistamine, and antipsychotic. While the most common types of drug used is ethanol, benzodiazepine, gamma hydrobutyrate or GHB, and the last one is ketamine or KET. That's all from me. Thank you.
Hello, my name is Putu Bintang Kirana with the digit of student number R033. I will be explaining about the rape drug mechanism of action. So there are many types of rape drugs, such as alcohol, benzodiazepine, ketamine, gamma hydroxybutyrate, and inhaling volatile substances, such as chloroform and aromatic petroleum hydrocarbons. So in that action, this rape drug will mainly act in central nervous system as depressant, which is resembling or mimic the alcohol intoxication effect, which will cause drowsiness, incapacitated ability to resist sexual advance, and anterograde amnesia. In the action for the perpetrators, they will often use this drug with concealment. So for oral intake drugs, the drug can be concealed in a drink, such as alcohol, where the perpetrator can discreetly add the drugs to unintended drinks and give it to the victim that unknowingly known if there is a drug in their drinks. So once the victim is sedated, the perpetrator may then exploit the incapacitated state of the victim and then do the rape. That's all from me. The next part will be explained by my friend. Thank you.
My name is Komang Wahyu Widyasanti Sutama with the last three digits of my student ID number is 086. Now I'm going to talk about effects of rape drug. First is ethanol or alcohol. Used in DFSA because it can cause impaired judgment, reduce inhibition, loss of control and consciousness, also compromise the victim's capacity to resist sexual aggression. Second is benzodiazepines such as flunitrazepam. This drug elicit confusion, impaired cognition, memory loss, drowsiness, fatigue, coordination issue, dizziness, leaving the victim unaware of the assault. Third is gamma hydroxybutyrate. Elicit sedation and anesthesia, enhance libido, lower inhibition, and induce memory lapse and drowsiness. Fourth is ketamine. In the context of sexual assault, a victim may retain awareness but is rendered immobile and incapable of resistance. Additionally, ketamine may induce amnesia, preventing the victim from recollecting the events. Ingestion of drug in the FSA can lead to impaired speech, mobility, and unconsciousness within 30 minutes. Individual response to drug vary depending on specific drug, dosage, alcohol or drug co-administration, metabolism, and how quickly medical assistance is provided. That's all from me. Thank you.
Thank you for the opportunity. My name is Jennifer Nathalie with last three digits of student number is 101. Now we will explain about the forensic pathology evidence related to rape drug uses. First is the definition of forensic pathology. Pathology, to put it simple, is the study of illness and injury. Forensic pathology is a subspecialty of anatomical pathology and general pathology that support the medical, legal, and judicial system in determining causes and manners of death, supporting the investigation of circumstances surrounding deaths, and aiding in the interpretation of postmortem findings of medical legal significance. As a field of study, it is situated at the nexus of the legal and medical domains and is closely associated with criminal justice, public health and safety, healthcare quality assurance, law enforcement, and public service. The history of forensic pathology over the past century has been marked by the essential fusion of innovation and tradition, with the primary goals being the pursuit of truth and scientific objectivity. That's all from me. Thank you.
My name is Anjani Prabandani with last three digits 148. I will explain about importance of forensic pathology evidence in rape drugs cases. Sexual abuse due to drug administration occurs when alcohol or drugs are used to reduce the victim's decisions so that sexual abuse occurs, it is important to check the presence of drugs in the victim's body immediately because it can be affected by the body metabolism. Blood and urine tests can show drug use when sexual harassment occurs on a certain date. The sooner the test is done, the greater the chance that the drug will be detected.
Good morning, my name is Edgar. I'm a digit of student number 8045. Next, I will present the types of forensic evidence relevant to rape drug cases. The first one is urine specimen. Detection of rape drugs is more likely in urine compared to blood, and it's crucial to collect urine specimen promptly. The second one is whole blood. Blood collection in addition to urine is recommended, preferably within 48 hours of the reported incident. The third one is head hair. In situation where the reported assault is delayed or when following chronic exposure to drug, head hair should be gathered at least 4 weeks after the alleged incident. And the last one is other biological samples. In certain instances, vomit found at the site of the reported assault or on the complaint clothing can serve as a valuable specimen. If a drug has not been completely absorbed before vomiting, it may be present in a relatively high concentration in a vomit state. That's all from me. Thank you.
Hello, my name is Kadek Pramudya Agastya, and my last three-digit number is 165. And now I will continue the presentation with types of forensic pathology evidence related to rape drugs case. For instance, drug-facilitated sexual assaults, or DFSA case, particularly among college-age women, are increasing nationwide. Alcohol and drugs commonly involved in sexual assaults impair cognitive function and make individuals more vulnerable, especially in assaults by acquaintance. Other than DNA, fingerprints are one of the most common types of evidence that can link a perpetrator to an assault. In certain cases of sexual assault, chemical examination of condom lubricants may also prove surprisingly valuable, as many assailants are serial perpetrators and routinely use condoms to avoid leaving their DNA evidence. Whether it's the inadvertent ingestion of dead rape drugs or the voluntary use of party drugs, toxicological testing is crucial for identifying these substances. That's all for me. Thank you, and my friend will continue the presentation.
My name is Davin Tadeo with the last three-digit number 099. Okay, if we talk about DSFA, drug facilitated sexual assault due to substance intoxication with or not voluntary consumption, we can classificate it with some etiology, and the biggest prevalence are the alcohol and followed by antidepressant, antihistamine, and benzodiazepine. Within this case, urine should be collected at any case in first 120 hours, and but the limitation in the reality is there's a drug such annex. Its metabolism is less than 120 hours. Okay, blood in is an addition evidence to urine, but it must be collected 48 hours after incident. Head hair is collected in a condition that victim in a chronic exposure to drug. And other evidence like cup, drinking glass, bottles, container play a big role too in here. And if we talk about a video and picture, uh, has a same great portion in this examination. That's all from me. Thank you.
My name is Tadeo Kristanto with my last three digit of ID number of 093. In this presentation, I'm going to briefly explain about the limitations of forensic pathology evidence in rape drug cases. The biggest challenge of collecting evidence related to rape drug cases is mostly because delay in reporting the crime, as most cases were reported several days after the incidents. Most rape drugs have a short half-life, already potent in small dose, and quickly metabolized by the body. As rape drug induce amnesiac effect to the victim, it creates an interval between the fact and the complaint, resulting in the drug has already been eliminated from the body or leaving only a limited concentration in the body. Therefore, a sensitive and highly specific method should be applied to detect drugs in a limited concentration in a biological specimen. To summarize, toxicological forensic analysis of rape drug case is a complex thing to do, as it often late in report, requires an adequate instrumentation. Drugs are quickly metabolized and eliminated from the body. Samples should be collected and analyzed as quick as possible. Time consuming and money consuming. That's all from me. The next part will be explained by my friend. Thank you.
Hi, friends and teachers. My name is Gwyneth Felicia with student number 110, and I'm going to explain about the conclusions. For the summary, date rape drugs, including ethanol, benzodiazepines, GHB, and ketamine, are a significant public health concern, facilitating sexual assault due to their tasteless and odorless nature. DFSA, drug facilitated sexual assault, impairs victims' cognitive and physical functions, which can hinder consent and complicating prevalence measurements. Forensic pathology, in this case, focuses on recognizing injury patterns and investigating DFSA cases. Immediate testing for substances like alcohol, rofinol, GHB, GBL, and ketamine is crucial, with blood and urine tests within the first hours detecting MDMA, flunitrazepam, GHB, and also ketamine. Challenges could include rapid breakdown of designer drugs, delayed reporting, and also complex toxicological analysis within 1 to 2 days. Forensic examination of rape cases assesses DFSA from substance intoxication and everything else in the same group of drugs. Key evidence includes urine collection within 120 hours, blood collected 48 hours post-incident, and also hair analysis for chronic drug exposure. Limitations include rapid drug metabolism, issues of victim consent, and also a low correlation with forensic evidence. For the recommendations, advanced research and development in analytical techniques to enhance sensitivity and specificity for detecting date rape drugs, addressing issues of rapid drug metabolism, and also developing accessible and cost-effective technologies to widen the availability of forensic services, especially in Indonesia. Exploring cost-effective alternatives to streamline processes without compromising quality, and also encouraging ongoing this interdisciplinary collaboration between the healthcare workers. That's it for me. Here are some references, and also thank you for listening to our presentation.